year after the COVID-19 pandemic, scientists have discovered over 5 variants of concern. For the purpose of enhanced diagnosis, the WHO has approved for emergency use rapid diagnostic test kits. This is our focus today on sound health. I'm Olasumbo Modupe. Welcome to Sound Health. We begin with COVID-19 updates.
More than 30 resolutions and decisions were adopted at this year's World Health Assembly in different areas of public health. In his closing remarks, Director General Dr. Tedros Ghebreyesus reminded delegates that the theme of this assembly was ending this pandemic, preventing the next, building together a healthier, safer and fairer world. He explained that it would be a monumental error for any country to think the danger has passed because cases and deaths are continuing to decline globally. Dr. Tedros urged countries to commit to supporting the targets to achieve vaccination of at least 10% of the population of all countries by the end of September and at least 30% by the end of the year. Also, he recommended a treaty on pandemic preparedness and response to strengthen both WHO and global health security. Dr. Tedros echoed that a strong WHO needs to be properly financed, as it has been amplified by all the expert reviews that reported to this assembly. He also urged member states to seize this pivotal moment and chart a course to a sustainable financial model. The Presidential Steering Committee on COVID-19 has again publicly declared 132 travelers as persons of interest for allegedly violating new protocols put in place to halt the spread of the dreaded coronavirus disease in the country. Chairman and Secretary to the Government of the Federation, Boss Mustafa, said the listed individuals who recently visited or arrived from India, Brazil and Turkey are potential health hazards to the society. He said the alleged violators evaded the mandatory 7-day quarantine at port health facilities before they were allowed to move about in the country. He urged them to urgently present themselves for appropriate evaluations, as the concerned violators shall face regulatory sanctions, including but not limited to disabling their travel passport for a period not less than 1 year, cancellation of visas or permits of foreigners that have abused our hospitality, and prosecution under the 2021 Health Protection Regulations. In Nigeria, more states have commenced the COVID-19 second dose vaccination. The program is in continuation of Phase 1 COVID-19 vaccination that started in March. 166,518 confirmed cases, 158,781 discharges, and 2,099 deaths have been reported in Nigeria. Globally, above 169.5 million confirmed cases of COVID-19, including 3.582 deaths, have been reported to WHO, while over 1.9 billion vaccine doses have been administered.
It's still Sound Health on Lagos Television. My resource person today is Professor Mohammed Yerima. He is a professor of microbiology and president of Biotechnology and Microbiology Society of Nigeria. Welcome to Sound Health, Professor Yerima.
Thank you very much, Modupe.
All right, Professor Yerima, can you bring us to speed the other variants aside from the B1617? Is the Indian double mutant variant of COVID-19 less severe?
Thank you, Modupe, once again. And thank you for inviting me to this talk. The SARS-CoV-2, which is actually the causative agents of COVID-19, has a lot of variants. And the variants that exist actually The ones of importance are those with high transmissibility. That is the variant whose transmission rate is very high, and those that has increased virulence, and of course there are those that have the reduced effectiveness on vaccines from them. These variants actually, as the name implies, they vary from one country to another. So UK have their own variants, India have their own variants, Brazil, have their own, South Africa, and of course many other countries. The Indian variants recently have shown to be highly virulent in view of the number of patients that are taken to hospital, and of course the number of deaths that really happen. Unfortunately, Modife in Nigeria here, we don't even know our own variant. I think probably due to the fact that we don't have specialized laboratories and to actually diagnose the type of variants that is affecting us. But I think it's a challenge to government, it's a challenge to scientists to really do something regarding that. Because diseases, when they occur, they have to be properly diagnosed before treatment, whatever, or vaccination procedure. So we really have to know our own variants.
All right, Professor Yerima, are these variants more transmissible and severe? And I would like to ask this question. Are the current COVID-19 vaccines, do they provide strong protection? And what role will they play in future surges now?
Yeah, actually what we have seen in the recent days, the vaccines that are deployed, for prevention against COVID-19, some of them are very, very effective, but they differ, from one country to another. I think racial differences may be responsible, because looking at the AstraZeneca vaccine, for example, recently I've seen, data information where they say it's only 60% for India, but it's 80% for other, countries and other things. What is foremost now in the world is to have an effective vaccine. Once a vaccine can, prevent COVID-19 by 80%, I think the success rate is set to be high. But where a vaccine is 50%, 40%, is a big problem. This is even good for countries that know their variants. Like I said, in Nigeria, we don't know our variants, and so the large chunk of money that is being spent to import vaccines, I think should have been used to promote indigenous research, to identify our own variants, and so on and so forth. This is particularly so because SARS-CoV-2 is one of the most, mutated organisms. I mean, it mutates so easily, and if you look at the virulence factors, which are basically made of a functional protein that is 3CL protease and the spike protein, you understand that changes in these, spike proteins and other things can lead to evolution and emergence of many variants. So I think we need to track down our own type of variant so that, we know the kind of vaccine. Because vaccine is a recombinant one, and the particular structure, either of spike protein or whatever, or the genome, particular genes responsible for the synthesis of proteins are used to make some of these things. So I think it's better to know them than to just be importing vaccines anyhow. You can recall also when the vaccine, was initially being administered to subjects, many complain of some, unusual reactions here and there, and so on and so forth. But I think it's important. Vaccines are effective. We are seeing results in different countries, really, and I think the whole world is shifting towards that thinking. That even for air travels, we have COVID-19 passport, whatever vaccination, just like it was done on yellow fever before now. So I think vaccines are still okay, but vaccines will work best if variants are well known and defined.
All right, Nigeria, like other countries, are already taking precautionary measures, but there is actually a loophole in the system now. Recently, the federal government just declared about 90 travelers from India, Brazil, and Turkey as a potential health hazard. What seems to be the problem now? Because I know we've actually advocated for increased surveillance and enhanced genomic sequencing now. What seems to be the problem, and how can we, make up for these laxities now?
Yeah, I think really the spread of COVID-19, it's made possible through, allowing people to come from other countries into Nigeria. I think it's a good step that the Nigerian government has taken. Wherever the disease is so serious, I think travelers from this country should be subjected to certain protocols, just like it is obtained in other countries. We cannot say we'll block people from coming because the economy is suffering. For whatever reason they are coming, I think there should be, protocols in place and facilities for testing to ensure that people coming in are well quarantined, and if they carry the virus, then they can be even repatriated. It should not be allowed to, because the recent data from the National Committee on COVID has shown that we are now recording very low cases. So if we are getting success in that regard, I think we should not be open to importation of the disease and other things. So testing centers should be established, especially in the airports, and not just in the airports, because Nigerians who are traveling out also will need to carry their, vaccine certificates and other things. So I think the testing centers should be improved, and facilities such as real-time PCR should now be a household thing, so that people can have access to testing, and people should not be afraid. One should not be afraid to know his COVID status, and it helps him, it helps the country, and I think that's my advice.
One of the precautionary measures by the World Health Organization is the use of rapid diagnostic test kits. And I want to ask you now, what is the difference between the RDT, the rapid diagnostic test kit, and the PCR? Is it that effective for enhanced diagnosis now?
What is the difference between what and what?
The RDT, the rapid diagnostic test kit, and the PCR test now approved by the World Health Organization.
Yeah, I get you. I get you. You see, the difference is that the RT-PCR, that is real-time PCR, actually is the most reliable test because it has 99.567, efficiency. And whatever results that are generated using PCR is reliable and dependable because it takes into account the detection of genes responsible, for the synthesis of the virulence factors, like I said before. The virulence factors of COVID-19 is a protease, it's an enzyme that actually is very potent in destroying the host proteins, and hosts really depend on these proteins, especially enzymes and some structural proteins for survival. And another one is a structural protein, the spike protein. The spike protein is like certain structures in bacteria and fungi that help the pathogenic organisms to attach to host cells. So SARS-CoV-2 actually use a spike protein structure to attach and penetrate host cells. And that is why it is considered as a virulence factor. And its synthesis also is directed by certain sequencing in the gene. So you can understand PCR detect those genes, and once they are detected using specific primers and other things, then one can be sure that if you have it, you have it, and if you do not have it, you do not have it. But some of the test kits that are available, they are based on, chromatographic analysis, a kind of protein analysis like ELISA, okay? And since proteins are products of DNA, and there is a possibility that some of them may not be detected in the serum of the host, because of the sensitivity issue. If the ELISA is not that sensitive enough, then some of these proteins may not be detected.
The Nigerian Center for Disease Control has approved the use of the RDT test kits in schools. But there is a clause. If a person with symptoms or high-risk contact of an infected person tests negative, a PCR confirmatory test must be organized to rule out COVID-19.
Yeah, it's very important. That is a very good thing from the NCDC, because you see, viral disease is not just SARS-CoV-2. Some of them, when you test for the first time, you still need to test after some time, because the protein level, in the serum may have gone down. So what the NCDC advocated is the right thing. Series of tests about 1, 2, 3 to confirm. I think it's in order.
The country will soon begin the next phase of vaccination. What advice do you have for members of the public that are still hesitant about the vaccines? Most people have not even taken the first dose, let alone the second dose. And I understand some states have just started vaccinating. What advice do you have for members of the public now?
Yeah, actually, I advise members of the public to make themselves available for vaccination. This is particularly important because viral diseases are very difficult to handle. There are no treatments available, so you can understand that they are better prevented than cured. So if government tries to spend money to bring whatever vaccine that is available, it's better that members of the public should make themselves available to get vaccinated. I think it's a very good thing. One of the ways to really develop prevention, and vaccination stimulates the immune system, to produce antibodies against the virus. And by the time, individuals or significant parts of the population, develop immunity, I think that can lead to herd immunity, and that can go a long way in giving protection to Nigerians. So I absolutely agree that vaccination programs will continue. Government should try to get the best vaccines, because there are so many in the markets now. Some are being donated, So we should get the best for our people, and our people should always go for vaccination.
All right, Professor Yerima, thank you so much for your time. This is all we have time for this evening on Sound Health.
Thank you, Nigerians, and thank you, Modike, for giving me the opportunity to feature in this program.
You're welcome. The conversation will definitely continue, and I hope you will oblige us again.
Yeah, and for you all the time, I have the responsibility to appear in programs like this and educate Nigerian public.
All right, thank you so much, sir. That was Professor Mohammed Yerima on the variants of concern and the use of rapid diagnostic test kit for enhanced diagnosis. He is a professor of microbiology. Sound Health continues with trending health reports. Please stay tuned. This is all we have time for today on Sound Health. Ensure you carry on with the COVID-19 protocols. Avoid large crowds, wear your face mask, and wash your hands with soap and water or sanitizer for at least 20 seconds. They are the most proven against COVID-19. For comments and inquiries, please send SMS to 0035 826603 or follow us on social media at LTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.